Hello, everyone, and welcome to ATP Live Monday. I'm not sure why I'm echoing. All right, I think I'll click off the Instagram one. Um, Welcome to ATP Live. I just hope the Instagram people can still see me, but let me go on my phone for Instagram. Mm, okay, I can see the Instagram people can still see me. All right, good. All right. So, welcome to ATP Live Monday. Please invite friends, family to join us. And what I'm going to do is to just share the video and make sure it is pinned on all our platforms. And after that, we can start to answer questions. So, whichever platform you're joining on, welcome to ATP Live. Okay, let me just refresh. Can see. I can see my okay, yeah, I can see my live video now. Okay, so ask me to share as well. Invite your friends, invite your family, anyone who may have any questions to ask a pediatrician. Just invite them to join us now, and we can start. And Instagram people, I can see you. So you can start to drop your questions and then we will try and answer them in the next 1 hour. So welcome everyone. I hope you're having a lovely Monday and welcome to ATP Life. Just a few more sharing here and there and then we'll be good to go. Good. Okay, welcome to ATP Live. If you have any questions, feel free to share your questions now. Okay, all right. I think I've done all the sharing, hopefully. Then what I'm going to do is to pin the questions. I mean, to pin the videos. Sorry. Okay, I think I need a cup of coffee. Okay, welcome. So please drop your questions as you're watching. If you have any questions about your children's health issues, feel free to drop them and we'll try and answer them. Please always include the age of the child in the questions. Always include information that's relevant. For example, if you are saying your child is losing weight, you are worried about the child's weight, we will need to know what the birth weight is, what the current weight is. So we need all those kind of information for us um, to be able to advise you appropriately. So always do that so that we're sure of your questions. So that's that. Okay, I think my Instagram is going to be a problem, so let me take it off. Okay, I think I'm good. Okay, yeah. But I've not seen any question on Facebook and I've not seen any question on Instagram. All right. So good evening, everyone, and welcome to ATP Live Monday. I am Jamie Solaboyde. I'm a pediatrician and I'm the CEO ATP, Axi Pediatricians Foundation. And we're committed to the health and the welfare of your children. And so that's what we do. So welcome to ATP Live Monday. Uh, in the next 1 hour, what I'm going to do is to answer any questions that you have about the health of your children, and you can get your answers live and direct. But if after the live session, or if you are watching a repeat broadcast, so you can always ask your questions on our Facebook group. We're there from Mondays to Saturday, every 24 hours every day. You can always post your questions, excuse me, and we'll try and answer them as soon as we can. So we're committed to supporting you to promote the health and the welfare of your children. And beyond that, we also do teachings on Thursday morning, 10 a.m. Last week, I talked about urinary ear infections. And I think before we talk about urinary tract infections. So you can always join us on Thursday to learn more about things that affect the health of our children. All right, so for today is just to answer questions that you may have about the health of your children. All right, I don't have any question yet on Facebook. For those of you who are watching on the Facebook groups, please, you have to click on the video so that you can put your questions directly under the video. Otherwise, I won't be able to see it. But I can see a question on Instagram now. Shufet Girl, say good evening, Ma. Sorry, where's the question? Okay. Thank for all you do. Please, how can I stop nose bleeding in my 6-year-old son? All right. So, some children are prone to having nose bleeding. We call it epistaxis. It is just something that they can have. Most of the time, there is no cause. It's just something that some children do have, but what sometimes is due to the fact that children have like respiratory tract infection or catarrh and all that, and they are picking on their nose. And in the process of picking on the nose, um, blood may start to flow. Also, sometimes there are other conditions that can also, make children to have nosebleeds. But most of the time, there is actually no reason for nosebleeds. I think the most important thing is that to know what to do when your child has a nosebleed, and the simple solution is to pinch the nose. However, most of us tends to do it the wrong way. We tend to uh, make them put their head back like this, and that is wrong. It's actually forward like this. You should bend forward. If you have a copy of our Ask the Pediatrician First Aid Tips, there's actually a section on nosebleeds. It's available online. You can download it. If you just check our Facebook group, you will see the if you check our platform, you will see the QR code for you to download our first aid course, the videos, and even the booklets, which we've been going around to schools to give. I'm not sure whether people can see it. Okay, my background, you won't be able to see it very well. But there's a section on the nosebleeds. I'll see whether I can pull up the picture later on, where you will see. But just for you to know that the way you pinch the nose is forward and not tilting the head backwards. And if you pinch it for a few minutes, usually we'll say 5-10 minutes, it will stop. But if the bleeding doesn't stop, then you have to go to the hospital. But it's something some children have, and after a while, as they get older, they tend to stop having nosebleeds. So that is the recommendation for nosebleeds. Okay, for Instagram people, if you've dropped a question and I miss it, please you can ask it again, because I kind of lose I kind of messed with my link and I couldn't see your question. Then Beauties in Clay say, good evening, ma. I'm a first time viewer. Oh, welcome. I would like to ask what to do to my picky eater who has no interest in food at all and is weighing so low. Beauties, can you tell us how old your baby is, and can you tell us what is the current weight? We always need to have that information so that we can advise you properly. So let us know what is the current weight and how old this child is. Okay, so there are lots of tips for fussy eaters, and you may want to. So your baby is 3 years old and is weighing 11 kilos. Okay, so 3-year-old weighing 11 kilos, and average 3-year-old should weigh like 14 kilos. So definitely the child needs to eat better. So the thing is to know, fussy eaters are children who are very particular about what they eat. So if they eat certain food and they don't eat other food. So what you need to do is to make sure that those food that they like, you try to give them a lot of them. That is number one. Number two, some of them don't like to eat a lot as it goes, so you need to feed them more frequently. So even if it's just a little, they would take, but instead of them eating like 3 times or 4 times a day, you can make it like 6 times a day. Another tip is to hide food, hide things like protein in other food that they eat. So for example, you can for children uh who don't like let's say fish or meat, for example, but they like swallow, you can make the fish or the crayfish, you can blend it very well and use it to cook, maybe something like a way to or like soup that they will take, so that way they won't see it, but the protein is eating inside what they are eating. So, and then you just keep encouraging them, let all the children eat at the same time on the table, so that they see eating as something pleasant and not something like a punishment and all that. But the most important thing is I just keep encouraging them, and hopefully with time they may not always eat so much, but as long as they are maintaining a healthy weight, I think we can live with that as pediatricians. Okay. Um Yeah, if you just didn't like fish, you can give other protein, you can give egg, you can give meat, you can look for alternatives, whatever the child likes to give, so those are the things that you can do with that. Okay, Olufumike is asking a question. How do I resolve the issue of itchy eyes? Who is having itchy eyes? How old is this child? Always start every question. Okay, you're 7 months old, baby. How do I get my 7 months old formula fed baby's poop to be soft? Number one, your 7 months old does not need to be on formula. Your 7 months old needs to be on complementary feeds and breast milk. Okay, so that is what you need to feed your child with, because formula feeding is the reason why your baby will be having constipation. So the first thing you want to do is to make sure that you're giving your child the right food. And what we recommend for a 7 month old is breast milk and complementary foods. And the complementary food, you have to make sure you are adding veggies, you are giving the child water, you are making the food to be in the right texture, food rich in fiber, but semi-solid, soft, not hard, and making sure the child drinks a lot of water. And you're also giving fruits, you can give veggies. So those are the things you need to give your child. As long as your child are eating food with lots of vegetables, your child is taking fruits, your child is sucking the breast, and your child is drinking a lot of water, the child will not be constipated. So most children are constipated because we're giving them inappropriate food, or they're not drinking enough water. So that is what you need to do for your 7 months old. If you are doing the right thing in terms of the appropriate complementary feeds, then your child should be fine. And then, is it the same 7-year-old that is 7-month-old that is having itchy eyes, because that is not quite clear to me. So if it is a 7-month-old having itchy eyes, the question is, are the eyes red? Are they discharging? And if they are, then you need to get the child to see a doctor. Preferably, they may refer you to see the eye doctor or the ophthalmologist. We need to be sure whether this child is having what we call conjunctivitis. And if it is recurrent, then we begin to think, is it an allergic conjunctivitis? And if it's an allergic conjunctivitis, what is the trigger for it? And that is what we may need to get rid of in the child's diet or whatever the child is taking that is causing the itching eyes. So that is that. I hope I've not missed out another person's question on Instagram, but if I did, please, I beg your pardon to um, send it back again. All right. Okay, let's go to Facebook now. I have one question here. Joanne Nedum Osakwe. Good evening. When does, I guess you mean, when does a baby's brain stop growing? So the first 5 years of life is the most important a period for brain growth. So 95% of brain growth occurs in the first 5 years of life. So that is the most crucial period. Of course, the brain keeps growing a little bit, even up to 8 or 9. The brain is an organ that can be very we call it plasticity. It means the brain can change and can adapt and all that, but majority of brain growth, 95% of it occurs in the first 5 years of life. So that is, I'm not sure why you are asking that question. It's better you ask questions, you tell us why you're asking questions so that we can really address your concerns. So, but if you're just asking theoretically, so that is just the answer I will give. All right. When months or what months can you train a baby boy to sit? Okay, the answer is that you don't need to train a baby boy to sit. Okay, children will sit by themselves when they're ready. Most children start, and it doesn't matter whether they are boys or girls, there's no difference. And children will start to sit with support from 5 to 6 months old. So most children by the time about 5 to 6 months, but the first developmental milestone, at least in terms of gross motor, is the neck control. So a child should have neck control. And then after that, usually that's around 3 months, 3 to 4 months. Then by 5 to 6 months, they begin to sit with support. Sitting with support means when they will get into the sitting posture, but they will be bending forward. So you need to stay behind them and help them to sit propped up. Then by the time they're about 7 to 8 months, they're able to sit on their own without anything behind their back, and the back will be straight. And by the time they're about 9 months, begin to crawl. And by the time they're about 1 year, they begin to walk on their own. So that is the average developmental milestones. Okay. However, some children may be a little bit faster, some children may be a little bit later. So the information I'm giving you is just for the average child. So, but then we have what we call the cutoff points when we will begin to worry as a pediatrician about your child if they are not at that point. But you don't need to train children to do any milestones. It is something they do as a result of their brain development. So you don't have to force them to do it when they're not ready. When they're ready, they just get into it and they do it by themselves. Okay. Oh Lord, I'm having problem with my Instagram today. All right, let's just move on. Next question. Good evening, ma. Please, can a woman breastfeeding have boil in her breast? Yes, a woman who is breastfeeding can have boil in her breast, just like any other person. And that is why you need to still take precautions when you're breastfeeding. You need to make sure that you're you are paying attention to hygiene, you're washing your hands, you're changing your bra, you're washing it daily. You're not just using bra, not having your bath, and you don't washing your hands. Of course, you can predispose yourself to having infections. And I'm using the boil, believing that you rightly meant boil means boil, because it's not every swelling in the breast that is a boil. Okay, so if it's a boil which is like what look like a pulse or something, then that is infection. That you have to take the child, you have to get yourself treated with antibiotics. You have to see your doctor so that they can treat you. And if it's a lot of, sometimes they have to take out the pulse from the breast. And during that process, you can't feed the baby on that particular breast. You need to use the other breast, and you need to express your breast milk until the infection has cleared, and you can now start to breastfeed the baby. And if hopefully it won't be more the two breasts, so at least you can be breastfeeding on the other breast, and then express the one that has the infection, the abscess, the pulse, or whatever away. But if it's a swelling you have in your breast when breastfeeding, don't assume it's a boil. You have to see a doctor, because you can have milk itself getting clogged milk inside the breast. Even you can also have breast lump for other reasons. So if you are not sure which one it is, don't just say it is boiled. It's better you get to a doctor first and let them be able to let them advise you appropriately. All right. Okay. Let's move on. I think, let me just say question on Instagram before I begin to forget, because my Instagram is messing today. Chifega, can ADD and ADHD be mistaken for autism? It depends on who is mistaken for autism. So if you're referring to parents, parents can always get confused. Parents cannot make diagnosis. And so even some professionals, sometimes they are not sure which one it is. So, but the right professionals, usually the developmental pediatricians, we should not have any difficulty separating autism and ADHD. However, some children can have both autism and ADHD at the same time, so they can coexist together. And so it is not every time autism can be separate, ADHD can be separate, but it's also possible for the same child to have both autism and ADHD at the same time. But there are ways by which we will know which one is which, but the two of them can also occur together. So just to give you a short summary, because I see a lot of parents always getting it mixed up, a child with ADHD usually do not have problem with their speech. They have normal speech development. They are sociable. They interact. They do all that. The only thing is that they are very hyperactive. They rarely sit in one place. They are easily forgetful of things. They are all over the place and all that. That is a typical ADHD. But otherwise, they have social interaction. They don't necessarily have repetitive behavior. They and all that, which we tend to see in children with autism. Whereas children with autism tend to struggle with social interaction. They tend to have lots of repetitive behavior. They may not have eye contact. They may have speech delay, or even if they have speech, they may not know how to use it for conversation. They struggle with having friends. They struggle with understanding social interaction, social cues, and all that. So that's more of autism. But you can have the two of them coexisting. So what I normally say is that if you suspect a child has autism or ADHD, please do not make a self-diagnosis. Try to see a developmental pediatrician. In some places, maybe the child and adolescent psychiatrist as well. They also do some assessments. It's from clinical psychologists. See the right professionals who are trained in making those assessments. And these diagnoses are not diagnoses that are made by you sitting in your doctor's office for 20 seconds, 20 minutes, or 30 minutes. No. So if you have been to a hospital and they sat with you for only 10 minutes and they told you your child has the ADHD or autism, that is not true. That is absolutely nonsense. Most assessment for ADHD and autism are assessment. There are specific assessment tools, and those assessment takes like hours, so 1 hour, 2 hours. So they are not something they will just ask you one or two questions and then immediately give you a diagnosis. The child will need a detailed assessment. Using the correct assessment, you will have a full report that will span pages. So that is how you know this is somebody that knows what they are doing. So, but if you go to your hospital, your doctor speaks to you 5 minutes and they told you your child has this, that no, they have not done a proper assessment. So you need to make sure you know So it depends on who is giving you the information. All right. Okay, if you're on Instagram and you've asked a question and I've not answered, please can you repost the question, because I think I may have jumped some questions. All right, now let's go on. Facebook, Hawa Ibrahim, good evening. My 4-year-old doesn't like taking breakfast. He eats well in the afternoon and at night. He prefers eating from 12 noon. I have to pet him to just take tea at times, which he rejects most times. So the question I would like to ask is, at what time do you start your day? What time do you give the breakfast? What do you give for breakfast? Because those are the things you really need to clarify first. And so if everybody is having breakfast at the same time as a family, then you need to let the child get used to having breakfast for the rest of the family. And then usually if a child goes to school, they are going to have their lunch break and all that anyway, which is okay. But I think the best thing is to make sure that you start the family life at the right time, and make sure you figure out what the child likes. It may be that what you normally offer for breakfast is not something he likes for breakfast. So you may want to ask what he would like. There will definitely be a food that the child likes that he would take, whether you give it morning or afternoon or night. So you may want to change around and all that. So that is good to have breakfast, especially for children when they are going to school, so that their brain, they have enough glucose, so that when the teacher is teaching them, they're able to do that. So that's fine. And then secondly, your child's weight is a little bit on the high side for a 4-year-old. Did you say it's a 4-year-old? Yeah. An average 4-year-old should be weighing 16 kilos. So your child is weighing 19 kilos. That is a lot. So maybe it's a good thing your child doesn't want to eat too much, but actually it's better to eat breakfast rather than. Then you may also want to cut down on all the junk food, pastries, biscuits, all those things that, make sure you are not adding those things to your child's lunch box. Give the child a lot more fruits, a lot more of healthy snacks rather than junk. So you need to pay attention to that weight. It's already too much as well. Okay, let's go on. The next question for Shukurat Abu Bakri. My baby likes sucking one breast. Is it breast you want to write? Check my breasts with hand I just checked yesterday. My breast had this lump, and if I press it, it is painful even without pressing. Okay, I'm finding difficult to understand your right of Shukura, but number one, your baby should be sucking both breasts. There's a reason why God gave you two, and that's because your baby needs to suck on the two and not just one breast. That is number one. Number two, you should not be having breast lump. Then you didn't tell me how old your baby is. So if you are breastfeeding and you're having breast lump, it could be engorged breast, it could be infection like pus and all that. We don't know which one it is. So, but since you are touching your breast and it's painful, you have to go to the hospital. If you didn't tell us how old your baby is, but I'm suspecting you may be having breast congestion. But if it is painful and it is red or it is hot when you touch it, that may suggest a breast abscess or infection. So the solution is that you must make sure your baby is sucking on both breasts. One. Two, you need to make sure your baby is well attached to the breast. So the baby should not just be sucking on the nipple. The nipple is just the part that is jutting out. You have to make sure that the parts beyond the nipple, that black part, we call it areola, also have to be in the mouth of the baby, so that when the baby sucks, the baby drains the breast. If your baby is sucking on the nipple, no milk is flowing out, and the baby will be getting frustrated, and the milk will remain in your own breast, and then they'll become clumped together. They'll become hard in your breast, and that is why you have this feeling of your breast is hard and it's painful, because your breast is engorged because the milk is not flowing out. So the way to get the milk out is for the baby to latch on properly to the breast and suck and drain out the breast, and you need to exchange the breast. So when you finish sucking on this side, if baby is fine, that's okay. The next time you're going to breastfeed, then you start from the other side, and then so that is how you make sure you exchange it and make sure the baby is well attached to the breast. We call it latching. If you need more information about breastfeeding position attachment, I'll recommend you go to our guide session. If you go to our Facebook group, we have a lot of, or if you're on our Facebook page, if you go to our video section, you will see the breastfeeding videos, and there's one on how to attach your baby to the breast. There's also one on how to handle breast pain and all that. So, and if you're doing that and you're still struggling, because if it's an infection, like there's redness, there's pus, you have to see a doctor because they need to give you antibiotics to deal with it. But the most important thing is to make sure you get that attachment of the baby to the breast, lashing, you make sure you get it correctly. So, and that will help. Okay, and let's move on. The next question, Ivy merits. Um, my daughter has been having rashes since 1 month ago. We've seen a pediatrician. Okay, the doctor prescribed this. It went off, came back. Another one came out in her palm, foot, and the rash has pus. And the doctor prescribed this and that, everything clear. But now the pus is back. So you need to go back to your pediatrician. Since you've been seeing a pediatrician who is treating your child, you need to go back to your pediatrician. But more importantly, this time around, you need to ask your pediatrician, why is your baby having this recurrent infection? And you also have to ask yourself, you didn't tell us how old your baby is. That is also important. So you need to also make sure you're paying attention to the hygiene, because I can see pus, I can see this. So that's more like a bacterial infection. So you need to pay attention to the hygiene around your baby, and washing is very important. Okay, before you touch your baby, before you change them, you make sure you wash your hands. Make sure you do the right thing in terms of the care around the baby. The environment has to be clean, the clothes has to be washed properly, dried properly, if possible ironed, so that will get rid of the germs. And washing, most of those infection in the causing pus and all that, they are from the hands of the carers, all those who are touching the baby, carrying the baby, yourself, even the baby too. You need to make sure, depending on the age of your child, which you didn't tell us, you need to make sure that you wash the hands of yourself and the baby. If the baby is about 5-6 months, when they start to touch things and explore the environment, you need to pay attention to that. So it's not enough for the doctors to just be giving you medication and giving you medication. The most important thing is to know, why is my child having these recurrent rashes? What is the predisposing factor, and how do I get rid of that, and how do I prevent? So ask your doctor more about prevention. Okay, so that is number one. Number two, I can see your doctor is giving you hydrocortisone with antibiotics. That sounds to me like contradictory, but I'm not really sure what your doctor is treating. But usually if a child has something like this, a bacterial infection, then you don't want to be giving steroid at the same time. So if you want to have a second opinion, either you have to seek a pediatrician opinion. But I've not seen the rashes, so I cannot give you my opinion. But I'm worried that your child is having recurrent rashes, and you're getting antibiotics, and you're also getting steroids. That sound contradictory to me. So the best option is either to see a pediatrician or to see a dermatologist. Those are the specialists that may want to see your child. But more importantly, prevention is key, because obviously when you use the medication, it's going, then it keeps coming back. So the question is, why is it coming back? And how can we prevent that? So I think that's what you need to work on. Okay. Joanne, good evening. Can you throw more lights on cerebral? I hope it's cerebral, because you wrote cerebral, but I guess it's cerebral atrophy. My friend baby was diagnosed with that. I want to know if there's any hope for our baby. Thank you. Number one, I will not be able to answer your question about your friend's baby. I don't think that is a fair question to answer. And I don't know all the details about your baby, your friend's baby. So we cannot give an opinion on the baby. I can only just tell you the meaning of the word cerebral atrophy. And cerebral atrophy simply means that the brain is shrinking, like the brain is looking smaller than how it should look. Okay, that is just the only explanation I can give to you. All right, so there are reasons why that can happen, depending on what's happened to the baby in the womb, during delivery, after delivery. But whatever happened, if a brain, when you do a scan and they told you there's cerebral atrophy, so they are basically telling you that the brain is kind of shrinking. So that is what it means. But we cannot give you an opinion about another child, even though it's your friend's child. That is not ethical, and that is not right. So if the parents want to know more about what will happen to their child and all that, that is for the parents to speak to a pediatrician and to find out for themselves. And the pediatrician will look at all the information about their baby, and they'll be able to advise them. They'll be able to tell them why it happened, what is happening, what is going to happen, and all that. But it's not something that I can give you an opinion on right now. Okay. Um, I've been married. The weight is down. Your question is too long, and when your question is too long, Facebook will cut it off. Ivy. So your question can only show up to I just use olive oil. So it means it was too long. You are giving too much information, but all the information you gave to me is enough for me to answer your question. I don't need the weight of your baby. And whenever you want to ask a question, start with the age of baby. My baby is so age. This is my concern. Don't put the age of the baby at the last part. And because if it's too long, then Facebook is going to cut it off and it's not going to show. I can't see it on my own screen because it's too long. So that is the issue there. Sorry, but I think I've given you your answer, which is what you really need. All right. Check here, delights. My son of 9 months does not like baby milk. Can I give adult milk or chocolate? No. What you need to give your baby is breast milk. Okay, that is the only milk your baby needs. There's no any other baby milk that your baby needs. For your 9 months old baby, your 9 months old baby needs to be on complementary feeds and, of course, breast milk. So that is all that. So your baby does not need any baby milk or chocolates and all that. No, don't give that. You can only give the normal regular milk, what you are calling the adult milk, from age of 1 year. So cow milk can only be given to babies from the age of 1 year. Before the age of 1 year, give your baby breast milk with complementary feeds. If you want to give any other milk, it has to be age appropriate formula. So if your baby does not like that, then just give your breast milk. There's no need for you to give any other milk. As long as your baby is taking breast milk and other food, that's all your baby needs. And please don't give junk like chocolates and all those things. They are not appropriate. If you want more information, you can go to our group and go to the guide section. We have a guide too on complementary feeding, so you can read more on how to go about complementary feeding. So that is that. Okay, I don't have any question on Instagram. So if you have any question, feel free to ask. So all right. So Shukura is saying, can you tell me some antibiotics I could use for the pain? Of course not. I can't tell you because that's not how doctors work. You know, doctors should ever just tell you go and buy drugs. Antibiotics have to be prescribed, okay? And it means you have to go to see the doctor for the prescription, okay? So I cannot give you a prescription like talking to all over all the world. That is not how it works. And please don't just go and buy antibiotics. It's a dangerous thing to do. There are more that goes into doctors writing drugs for you than just me talking and say, oh, go and use this. No, there are lots more that go into that. And please, this 2024, let's not abuse antibiotics. So this attitude of we just go to the pharmacy and buy antibiotics, it is wrong, it is dangerous, and we're going to get into much trouble. So before doctor prescribe drugs, they need to even ask you, have you ever reacted to this drug before? Have you ever reacted to sulfur drugs? There's more that goes into prescription. We need to know your age. We need to know your weight. We need to know the dose for you. So it is not just go and use this drug. No. All right. We need to confirm the diagnosis. You only told me that you have breast lump that is painful. I don't know whether it's breast congestion. I don't know whether it's a abscess. I've not gotten that information, so there's no way I'm going to say go and use antibiotics. So what you need to do is to see a doctor first, okay? And then the doctor will make a diagnosis because they will see you, they will examine you, they will ask loads and loads more questions that I can ask you on this kind of a forum, and then they will be able to give you a treatment that is tailored to you, depending on all the issues about you, and then that is what to do. So we cannot just recommend antibiotics like that. All right. Okay. Okay, I think I have one more question on Instagram. Okay, Shifra girl is saying my 2-year-old sucks her tongue too much. She puts her mouth on my body, like my leg and hand. Is this something to worry about? That is definitely not a normal behavior. It could be what we call a sensory seeking behavior, but on its own, you can just kind of discourage it, and all that. But if there are more to your child than just the fact that your baby likes to suck a tongue or puts a mouth on you, then you definitely need to see a developmental pediatrician and all that. But if it's just an habit thing, then we just encourage you to tell the child not to do that, and distract her away from it and all that. But if there are other issues with that child apart from this sensory part of it, then you definitely need to see a pediatrician for proper evaluation. Shifegal, I hope that is correct. Alawumi Awonunga, good evening. My one baby is 1 year 4 months, has stopped feeding. Stop feeding. Which feeding? You mean stop breastfeeding? Because I hope your baby is still eating, because everybody still needs to eat, even yourself. So nobody should stop feeding at 13 months. But I want to assume you meant breastfeeding. It is regular home food, okay? Baby cereal. When can I stop knife feeding? It drinks age appropriate milk at night. Okay. Your baby does not need to drink milk at night. Your child should drink during the day. Okay. If your child is no longer breastfeeding, you need to make sure that they eat well and during the daytime. So hopefully the child can sleep through the night. The dentists definitely don't like you giving them bottled milk or anything at night. So that is a appropriate thing. But if your child is still waking up, because some of these things, because it's an habit you have introduced to them, so they always want to take something at night, then you have to make sure you give them. If you give them milk, it has to be from a cup and not from the bottle, okay? And then by the age of 2, we want it to stop. Maximum by 2 years old, all those night feeding should stop. But if you feed your child well during the daytime, they should be able to sleep well through the night without needing to take anything, So that is the idea. So, but if you are still doing it because you cannot suddenly just stop, you can still give milk, but please give it only with a cup and not the bottle. It's so important that you don't do that. All right. Okay, let's go on. Facebook. Titi Merriment. How do I get my baby to know how to chew food? How to chew. So your child should have teeth and they should chew normally. But I know some children just like to swallow their food and all that. So what you need to do is that, number one, you need to teach the child how to chew. So there are some toys that are like chewing toys, just give the child to chew on them. Even this is apart from the time for eating. So the child get used to chewing on things. Number two, make sure you cut the food so small. Make sure the food is soft. At least the child can, there's nothing that's going to happen to the child as long as the foods are soft and the food are easy to swallow. So the child is not going to choke on them before chewing them. So that is our main concern. But the main thing is chewing is there are other reasons why it's important for children to chew, for their speech development and all those kind of things. So you can buy them cheweries. These are like toys that children can chew on so that they can practice with that, and then you make it easier for them to learn to chew their food. But also, more importantly, try and mold it as well to the child. Also try and cut the food into tiny pieces, make sure they're soft, and make sure it's easier for the child to chew on them. So it's a practice thing, but it's not at this age, 1 year 7 months, we're not like particularly too worried about it anyway. But hopefully with time the child will get to that point where they can chew properly on the food. All right, I hope that's helpful. Okay, my baby of 10 days with jaundice of 14.2 mil. We don't say jaundice is 14.2 mil, so it's actually milligram per day. But anyway, jaundice of 14 for a 10 days old is not that very high, but it depends on what it was before. So and it also depends on the baby. Again, we don't treat results, we treat the child, because sometimes you see a child and then you see the result, you're like, oh, they are not compatible. There are times that we sometimes even send test results to like 2 3 different labs at the same time, because we want to be sure. So I cannot just tell you this is what to do because of this result, because I've not seen your baby. I would recommend that you see a pediatrician, let the pediatrician look at your baby physically. Let them check for the, how severe the jaundice is on the baby. They say, well, we check on the skin, and if we think this result is matching what we're seeing on the baby, usually for most of the time we want the jaundice to be below like 10, most times. So, but because the issue here is that I don't know what it was before, I don't know what it is right now. So we need to know, is it going to still go up or is it going to come down? So at least for somebody to make good decision, you need at least 2 results. You need to get a second result to say it is coming down, then you can relax. Or it wasn't very high before and this is now the low level. So, and are you breastfeeding your baby? How is the baby physically? So if you have done a test, I assume you've seen a doctor. So I'll recommend that you get that doctor to have a look at your baby and then let them decide what to do. It is not like very, very worrisome level, but it's about, are there other issues with this baby? Is it the beginning or is it the end and all that? I cannot answer that. But I really think a pediatrician here need to have a look at your baby first, and then they can now decide what to do. Okay, I'm not sure what 15 is before. I'm not sure what you meant by 15. So that is standing in isolation. So you may need to clarify what the 15 is. And then, is your baby a preterm baby? Is your baby a term baby? What is the weight of your baby? There are many questions that we use when we're interpreting jaundice. So it's not just, for example, if your baby was a preterm baby weighing 1.5 kilos, 14 will be very high for that baby. But if your baby is a 3.5 kilo baby, then I won't worry about that. So there are more questions, more issues. But I would just say, please see a pediatrician, because we need to be sure where this jaundice is going and all that. So definitely, if it's already 14, it's definitely not physiological jaundice. So we just need to know what is the cause of the jaundice, and is it getting lower? Is it going to go higher? Do we need to do anything, or do we need to watch? I'll leave that for your pediatrician to decide. All right. Okay. I don't think I have any more question on Instagram. If you have any question, we still have about less than 15 minutes to go. Feel free to ask your questions and we'll try and answer them. But before we go on, let me just remind us that if you have any questions after we are off, after we are no longer live, you are free to post your questions to Ask the Pediatrician Facebook group. Let me see whether I can put the link and all that. But most of you know where our Facebook group is. So feel free to post your questions there from Mondays to Saturdays, and our moderators, professionals will be able to answer your questions. And if you want detailed, because this is a live show, so I'm trying to keep my answers short and straightforward. But if you want to know more about certain conditions, like the issue of jaundice, or you want to know more breastfeeding, you want to know more about complementary feeding, you want to know more about fussy eaters, you can go to our website, and then you can read on all the topics that is of interest to you. Or you can also go to our YouTube channel, Facebook page, and look out for the specific videos, ATP Hour, or even my podcast, Access or maybe ATP Podcast. You can go through those ones, and then you can watch or you can read, and you can get the detailed information about each of those topics that of interest to you. And usually on Thursdays we'll do our teaching on a particular topic. So and that we're going to have different professionals also coming to do topics as well. So feel free to use all the resources that we have and learn more about any topic that of interest to you. So thank you so much. I still don't have any questions on Instagram, so I hope I didn't jump anybody's questions. So let me just go high up. Okay, I don't think so. Okay. And just to remind us, today's World Leprosy Day. It's not something common in children, but just for us to be aware they see that condition, which of course the world is trying to get rid of. Yeah, just for knowledge, but it's more of an adult issue unless a child born to somebody who already have leprosy or people who have leprosy and all that as well. It's very rare in children anyway, but today's the day we celebrate the World Leprosy Day. All right. Okay. I seem to have a break today. So I just maybe now that I have a break, I can take a little bit more on the person who asks about fussy eaters. So question about eating is very, very common in children directed to the pediatrician because parents sometimes struggle, and I think it's only when children are young we want them to eat. When they are old, they're teenagers, and we want them to stop eating. So it's just like one of those things that life we have to deal with. But just to say, the first thing is to make sure we get it right. Some children will be forcing no matter what you do, no matter how good you are. And it's okay. We are not really worried as long as the child is eating enough to be healthy. So some children are fussy eaters, they just don't like food no matter what you do. But what we worry about is when they now start to lose weight. So the weight is really they are becoming underweight or malnourished. That is when we worry. But if some people are fussy but they still have good weight, they're still healthy, it's okay. You don't have to stress yourself about those ones. But for the ones that are losing weight, that is when the pediatrician and the dietitian comes in. And what we normally recommend that we get it right from the beginning. From that 6 months, we need to get that complementary feeding right. Let's not jump on all this bottle feeding and formula. That is not what complementary feeding is. Complementary feeding is giving real food, the food you have in your kitchen to your children. Just that when we're starting, we start gradually, and then we gradually increase the texture, increase the quantity, and then the variety. So that is the key thing. And every child also like what they like, so you want to capitalize on that, but you can also give it in different variety. All right, let me pause. I have a question on Instagram. When can I start brushing for my 8 months old, and what should I use? Okay, so the dentist recommend immediately your baby bring out, even if it's one tooth, the first tooth, you should start using toothbrush and toothpaste. Okay, so it's toothbrush and toothpaste owns their teeth. Usually by the time they're about 5 to 7 months, they start to bring out their very first set of teeth. And only to see them, get your toothbrush, get your toothpaste. Of course, there are toothbrushes for children, for babies. They're actually very soft, very small. And then the toothpaste has to be fluoride containing toothpaste. Okay, so fluoride containing toothpaste. They have a particular quantity, units per thousand, as they normally call it. But to make life easier, they always write this one is for children, baby, or milk teeth toothpaste. So you can use those ones. and then make sure they have fluoride inside, and make sure you use your toothbrush. So I feel like if your baby already have any teeth at all at 8 months old, because not every 8 months old they have teeth. Some don't. Some even 13 months before they have their first set of teeth. It's fine. But just make sure that once you can see teeth, or even if it's one tooth, make sure you start using toothpaste and toothbrush for your children. So that is what our dentists recommend. Before then, what you can do is just use ordinary clean clothes and water. If your baby does not have any teeth, you still need to clean their tongue because of the milk coating and all that, and you can just use ordinary uh, uh, clean face towel with water and just wipe it. Please don't use things like borax, glycerin, what else do people use? All these things, please don't use them. The dentists do not recommend that, and they frown heavily on them because they have other damages that they can do to your baby's mouth and tongue. So before teeth, water, and clean clothes. After the children have started bringing out their teeth, then you can use toothpaste and toothbrush that are age appropriate. So that is the answer to that. Okay. So I think I'm going to be rounding up now. So if you are just coming on, feel free to say ask your question. I have 5 minutes left. But if you are coming and you are watching me after we have left, which means it's already past 7 p.m. on West African time on a Monday, it means you are watching the recording. So what you need to do is, if you have any question, please don't drop it now. If it's already after 7 p.m., what you need to do is to go to Ask the Pediatrician Facebook group. Um, you can post your questions there from Mondays to Saturdays. And our pediatricians, professionals, moderators will be there to be able to give you the answer to your questions. And also, you can join us on Thursday, 10 a.m. West African time. Everything is West African time because our base is Nigeria. So that is our unit of time. But we know that people are watching us from all over the world. So I always like to emphasize the West African time so that you just as a reference, but you can convert it to your local time. So from 10 a.m. on Thursday, we'll be taking a teaching on one of these topics that we have asked questions about and going into details about them. All right. So feel free to always join us. And just to remind you that if you want to watch all the past episodes of ATP Hour or ATP Live, you can watch them on that same platform, whether it's Instagram, YouTube, or Facebook. You can always watch past episodes, and you will learn a lot more from them. But if you are the type that like to listen, make sure you are listening to Ask Dr. Baby ATP podcast on Spotify, any of the podcast platforms. Just Google it, you will get one. And also, if you like reading, you can read on our website, www.askthepediatricians.com. So those are the various platforms where you can learn from our teachings, and you can also ask your questions. All right. So thank you everyone for joining us today. And thank you so much for asking your questions. And we hope we'll be able to answer your questions. And feel free to still post your questions on our Facebook after this live session. And then we will see you same time next week. So I'm just going to say bye bye and have a wonderful rest of your evening. And it's bye from me. Okay, what you could say, God bless you, ma. Yeah, thank you. I know some of you are watching, but you don't have any question. That is absolutely fine. Thank you so much, Mwachiko Mata, for joining us and for watching. And thank you to all of you on Instagram. I can see you. because now Instagram we're doing it live simultaneously, so you can also see the comments from Facebook, which is nice. But it was echoing, so that's why I have to come off it on the live one. But thank you so much. But I can still see your questions as well. All right. So good night, everyone. Bye.